Hello there and welcome. If your child is getting ready for a tonsillectomy or an adenoidectomy, you are absolutely in the right place. Think of this as a friendly, reassuring guide to help you and your family feel confident about the whole process. Look, it's completely normal to feel a bit worried, maybe even have a million questions running through your head right now. Anytime your child needs surgery, it can be stressful. Our goal here is to help turn that anxiety into confidence. So, we're going to walk through everything step by step. We'll cover why the surgery is needed in the first place, who the expert surgeon is, what you can expect on the big day, and of course, how to make recovery at home as smooth as possible. Okay, first things first, let's really get into the why behind your doctor's recommendation. What even are tonsils and adenoids, and why do they sometimes have to come out? So, you can think of tonsils and adenoids as little germ traps. They're part of your child's first line of defense against sickness. But here's the thing. As a child gets older and their immune system gets stronger, these tissues become way less important and can sometimes end up causing more trouble than they're worth. So why would a doctor suggest surgery? Well, there are a few big reasons. Maybe your child is getting sick all the time. We're talking 5 or more infections in just 1 year. Or maybe the tonsils are just really big and they're causing issues like loud snoring, pauses in breathing during sleep, that's sleep apnea, or even making it tough to swallow. All right, let's move on to something really important. Who is going to be performing this surgery? Because it is absolutely crucial to know that your child is in the best possible hands. Your child's procedure will be in the expert hands of Professor Dr. Ahmed Nofal. He's not just an ENT consultant, he is the head of the department at Reem Hospital in Abu Dhabi and is truly a globally recognized expert in this field. Let's just take a quick look at his incredible qualifications. We're talking about more than 20 years of hands-on experience. Plus, he's a fellow of the Royal College of Surgeons of Edinburgh, which is a huge deal. It means he's met the highest international standards in surgery. And his specialty? It's pediatric ENT and the most modern gentle techniques out there. And to really put his experience into perspective, Professor Nofal has performed over 4,000 of these advanced surgical procedures. Just think about that. That incredible level of skill and expertise is what he's bringing to your child's care. Now, let's talk about the surgery itself. It's really interesting to see how modern technology makes this whole process so much safer and, honestly, gentler for your child. Professor Nofal uses an advanced method called the cobblation technique. So, once your child is safely and soundly asleep, a special tool uses low-temperature energy to just gently dissolve the tissue. The whole thing is super quick, usually just 20 to 30 minutes, and it's all done right through the mouth. No cuts, no stitches on the outside whatsoever. So what's the big deal about this technique? Well, when you compare it to older traditional methods, cobblation means way less bleeding and a lot less pain after the operation. And what does that mean for you and your child? A much faster, smoother, and easier recovery. It's really all about making this as gentle an experience as possible. Okay, on to the practical stuff. Here's a super simple checklist to make sure everything on the day of the surgery goes off without a hitch. Now listen up, because this is the most important rule. Fasting. Absolutely no food for 8 hours before surgery and no water for the 2 hours right before. This is non-negotiable. It's for your child's safety with the anesthesia. Also, make sure the team knows every single medication your child takes. And you know what? Don't forget to pack their favorite teddy bear or blanket for a little extra comfort. All right, the surgery's done. Now, understanding what recovery looks like is the key to managing it calmly and effectively once you get back home. So most kids get to go home the very same day. You should definitely expect a sore throat. And here's a heads up. Ear pain is super common, but it's not an ear infection. It's just pain from the healing throat that travels up to the ear. A mild fever for a day or two is also totally normal. The main thing is just rest. Lots of rest. No sports or running around for 2 full weeks. Okay, this next part is so important for your peace of mind. You need to know the difference between what's a totally normal part of healing and what's actually a warning sign. You are going to see some things in the throat that might look a little scary, but they're normal. It's the stuff on the right side here that you really need to keep an eye out for. Let's really focus on this one, because this is the #1 thing that makes parents worry. You are going to look in your child's throat and see these white or yellowish patches. Do not panic. Think of them like a scab you'd get on your knee. It's just what healing looks like inside the throat. Honestly, it's a good sign. So, when you get home, you basically have 2 main jobs. keeping your child hydrated and comfortable. Getting them to drink is so important. Water, juice, clear soups, whatever works. And you'll want to stick to soft, cold foods. Yep, this is the perfect excuse for plenty of ice cream and yogurt. And please, stay right on schedule with the pain medication. Keeping them comfortable is key to a good recovery. And finally, and this is probably the most important part, let's go over the really clear signs that mean it's time to call the hospital or head to the emergency room. Now, complications are rare, but you need to act fast if you see them. Go to the ER right away if you see any amount of bright red blood from the mouth or nose. You also need to get immediate care if there's a high fever that lasts for more than 2 days, if you see signs of dehydration, like really dry lips or no tears when they cry, or if the pain just isn't getting better with the medicine. And please, remember, you are not going through this alone. The amazing team at Ream Hospital is there for you if you have any questions or concerns at all. Keep this number somewhere handy. You know, this surgery is such a positive step. It's a step towards better health, better sleep, and way fewer 6 days for your child. And by being informed and prepared, you are playing the most important role in making sure they have a great recovery. You've got this.